This is not a regular church. It is a makeshift health center that caters for over 60 women and their children in the Tetegu community.
I sorry them. Inti abawa hana ya wofo na enye yefe say betumi aba weyi e wa sorry them. Inti ankasa yes ra ban so moaye na ombesi yeso ye hospital e maye. Ameko akawe ba wo kwa nipa wo inti wo betena ho san bedu tampa antanata bedu so e be hwe mpo na wa bre wo kompo nipa wo nti akonwa na wo ne so a unya ba bi mpo ntena ebi abegina wo san obi sori ansa wo so anya ba bi atra nti aye bre na even awo kan so awo ko hospital ebi anaya na jumpo a eye kwan na enye nti ansa na card wo be kwa kodu junction so mpo we wo be bre kan pushi san na wo kra wo bre wo be kodu osusu awo kan krofo be bre mo wo nti bi won po be kodu empampo ni wa wo be da so.
What could be some of the challenges in receiving healthcare under such condition?
It's a bit hectic, but we got to do the work, so we have to do it. That's why we are doing it. The most difficult one is when it rains. So as you can see, it's raining. In maybe 30 to 40 minutes, you see the whole place started flooded. So coming to this place when the rains are in is a big difficulty.
The pastor of the church explains why the benevolence.
When it came, it's like they started meeting at under the tree there. There is a neem tree. They started meeting there. But because of sunshine and also the rain and disturbing them, so I decided no, that place is not good for them too. So once we have a room here, they should come and then take over.
What is revealing and so surprising is the fact that there's an abandoned chips compound just a few minutes from this church. Sources explain that a feud between the contractor and the current MP for the area, who doubles as the deputy health minister, Tina Mensah, has led to a complete halt of a project started by the then NDC parliamentary candidate Obobia Darko Opoku. It was left to decay after her party lost the last elections. The facility, abandoned for over 2 years, has now been turned into an accommodation for a caretaker who maintains it. The chairman of the Community Health Committee seems frustrated at the situation.
I think that was last month when I heard of a woman giving birth in a car on her way to the clinic, but eventually they lost their baby too because the road wasn't good. Before they got to the hospital, they lost the baby. But luckily for us, the mother was okay. So those are the things. It's very painful to see women going through this kind of pains to assess health.
But the municipal chief executive for the Wejagbawe area says his outfit is working on constructing another health center.
We got around the project and realized that the contractor was not willing to hand over the project simply because he said the funds that were used in putting up that building was coming from the 10% that was deducted from the SWA government's staff at the was it Flagstaff House, and for that matter he's not been fully paid, so he see no reason why he can hand out that project. What we did was that the minister went to the extra mile in making sure a chip compound is put up at that same area around in the same community, and I can tell you that a contract has been awarded, and in the coming days the project will start coming up with a new one, because the old one we haven't gotten the real owners of that property, and for that matter the deputy minister have to come up with a new project.
But for the benevolence of the pastor, this spot right here, right under this tree, used to be the only place women in this community could receive health care. It is hoped that soon something will be done to address this situation and a proper facility put up to address their concerns. For City News, my name is Michael Obodu.